Government trainings. We've all been there. In large auditoriums, in big groups, seeking out the last seats, learning a little, missing most, and wishing it would be over. And then we are faced with situations, real life, on the ground, and we are at wit's end. We rack our brains for some memory, some solution. But what if the solution was on your phone? A reference by your side at all times. A go-to encyclopedia. That's Chikitsa Setu, your friend, your guide, your own personal trainer, in your pocket. There is a knowledge gap, known, understood, acknowledged. When a nurse at a remote primary health center can't take a nasal swab correctly, or a Safai Karmi in a hospital doesn't wear his mask properly, or an Asha worker doesn't know the signs of a mother's preeclampsia. This knowledge gap can mean the difference between life and death. And in that moment, there is no train, no one to call for reference, no one to help. Necessity is the mother of invention. COVID came with the force of nature, destroying lives, economies, and society as we know it. We were running and scurrying to cope. COVID, for the first time, forced us to conduct everything remotely. It was killing people, and there were some who were tasked with battling it. Our warriors, the Corona warriors. The battle lines were drawn, humanity versus nature's wrath. But like all soldiers in battle, they needed training to deal with this never-seen, barely understood, yet incredibly powerful and destructive enemy. Important training and important information that was evolving, changing, needed to be sent to the warriors quickly, efficiently, so they could help themselves and they could help our country. Chikitsa Setu was born, a trainer, a shield, Dronachar to the warriors, a bridge in the gap of knowledge, a bridge to build human capacity, built on the principles of Jan Bhagidari, an app for the warriors by the warriors. We did a survey of 75 districts and came up with the questions and doubts. Then we went to the best medical institute in the state and asked them to answer the questions simply and shortly. We put these videos in a simple app, one that a child of class 5 can use and learn from, so that everyone from the Safai Karmi to doctors can use it. It was collaborative. It was perceptive. It allows users to ask questions. It's bilingual and data light, so anyone, anywhere can use it. And it created an impact. Not exactly measurable, but palpable. At a time when protocols were changing and a misstep could be disastrous, Chikitsa Setu was the bridge of knowledge for one doctor who learned, or one institute that got the latest ICMR guidelines overnight. Thousands were affected. We expanded it, allowing webinars so that a doctor in Jharkhand and a nurse in Manipur can hear Dr. Naresh Trehan or Dr. Guleria. In the second wave, we introduced a WhatsApp feature to allow volunteer doctors to give advice, reducing burdens. Chikitsa Setu, created by Prashant Sharma and team, brought the future to government trainings. It was adopted by 5 states, endorsed by Ministry of Health and Family Welfare Government of India and Indian Medical Association. It was used to train lakhs of warriors across towns, cities, villages and small bastis. It had more than 2 lakh downloads and over 1 million views on the videos. It also unlocked a potential government training in the past that had not changed since independence. Large auditoriums, halls and seminars. No matter what the situation, the world has moved on the internet, and from smartphones and everything from colleges to how to assemble a table, information is disseminated online on people's phones. Chikitsa Setu brings that to training. There were Corona warriors in UP. Training them is a burden, but restraining and knowledge gap is a bigger burden. This reduces the logistical, economical burden. It helps increase human capacity like no other. We have the best trainers for each person. Maybe a doctor in tribal Orissa may never be able to hear Dr. Guleria, but in Chikitsa Setu, they can. Chikitsa Setu bridges the knowledge gap and creates formidable human capital, an army ready to defeat the biggest enemy humanity had seen, the coronavirus. Welcome to Chikitsa Setu, the future of all government trainings.